Where is plantar fasciitis located is this week's question that's come in by email. So plantar fasciitis, so the itis section of that name implies that it's inflamed. So the plantar fascia is the anatomical structure in the foot that runs from the heel to just behind the big toe. So if we look on the side on, basically what it will look like is it's where this pen sits in the foot. And so it's inflammation of the plantar fascia. So basically what happens is, if we understand what the plantar fascia actually does, if you think of this ligament that runs in from the heel to the forefoot, what it actually does, it helps to keep the foot's bones tight packed, so it pulls the foot together. And this is really, really important in walking, as when we tight pack that foot, it makes it a very efficient lever for propulsion. So you can imagine if we're walking and we're trying to push off a foot that's a very rigid lever, it's very efficient to push off, and most of the force goes through the ground and propels us forward. But if the foot is pronated and all these joints unlock, it's a very inefficient lever for propulsion. So what happens as we go to push off it, all the energy of our pushing off is lost through the foot and we don't propel very quickly. So the plantar fascia's job is to hold the foot in a tight packed position to make it an effective lever for propulsion. So this works really, really well when the foot's in a nice neutral position. However, when the foot's pronated, it works very inefficiently and the plantar fascia gets stretched and gets put under too much load. Now, if we put the plantar fascia under too much load for too long, it starts to get little micro injuries in there and they start to cause inflammation, and this inflammation shows up as pain and we get plantar fasciitis. So when you've got plantar fasciitis, you can get it anywhere from just behind the big toe all the way down to the medial tubercle of the calcaneus, which is this little lump, if we can see this little lump here. And so basically that's the location of plantar fasciitis, is within the plantar fascia in the foot. It's made worse by feet that pronate or roll in too far, and we usually treat plantar fasciitis with orthotics, stretching, footwear changes, strengthening exercises of the calf muscle. We also do physical therapy on the calf and the plantar fascia to try and get some elasticity back into both the calf and the plantar fascia. And then often we use cortisone, and if in very rare cases we might use surgery if the plantar fasciitis has been left too long. We appreciate the questions you're sending in, guys. If you'd like to hear more about this or you have any comments, please comment below. But I look forward to hearing your more questions. Thank you. If you enjoyed this video, please like, comment and subscribe to our channel. It's very simple to do and it really does help us out. If you'd like more information on the topics discussed, please check out the links in the description, and this will take you to our website where we can discuss these in more detail. If there's a specific question that you have or you'd like answered, please comment in the comments section and we'll do our best to make a video to address this. Thank you all for watching, and we'll see you next time.